Today, I am also very happy to introduce two of our leading nurse innovators. We spent the day really listening to a lot of physician scientists and administrators and researchers discussing pediatric innovation. We definitely want to highlight the amazing innovation coming from our nurses. I personally have worked with several nurses who have innovated various processes that other hospitals have asked to have them consult using those innovative processes, and also develop various devices that have been licensed and put into use. So today we're going to hear from Dr. Christine Taylor and Dr. Annette Nasser. Christine is the Interim Executive Director of the Center for Professional Excellence and Inquiry, and Dr. Annette Nasser, who's joining us virtually, I think I see you there, Annette, is the Director of Nursing Research and Evidence-Based Practice at Stanford Children's Health and Assistant Clinical Professor at the Stanford School of Medicine.
Charlotte, thank you so much for inviting us to be here today, and it is a true pleasure. I was fortunate to be in person this morning at Li Ka-shing for the beginning of this wonderful conference, and I'm beginning to understand Dr. Wall and Dr. Leonard's statement that this is one of their most favorite days of the year. So it is just really, really nice to be here today, and I have to say that each session has been just fabulous. I so enjoyed the last session and Andre Bassett's last comment about the 5 Ps, which is just so phenomenal. Today, I am happy to be presenting just some preliminary data on a study that's going on at Stanford Children's Hospital. Unfortunately, the 2 main investigators of the study were unable to be here today. Amelia Sperber and May Casaza could not be here today. They're both nurse practitioners in the pediatric neuro ICU, and they're really leading the study. I have been more of a consultant and senior author on many on what we're doing, but I just wanted someone from the research team to be able to present today. So I'll do my best. So this study is looking at Apple Watches. The study title is, does the Apple Watch reliably detect seizure activity? So when the Apple Watch 6 series came out, both May and Amelia were wondering whether we could determine this Apple Watch series, if we could determine the sensitivity of the watch in detecting seizure activity through heart rate and through oxygen saturation variances in the pediatric population. This technology, as you can imagine, is pretty easy for kids. I know we've been talking about all the struggles in pediatrics, but this study is actually quite fun for the kids. A little bit about the timeline. We actually received funding for this study through our Legacy Grant internal funding source. This is a grant process for nurses at both Stanford Hospital and Stanford Children's, and it's made available by the Nurse Alumni Organization. There used to be a School of Nursing here at Stanford. It closed in 1972, and they award nurses with small grants to do studies. So it's a very competitive source of funding, but we were able to get some funding in 2021. We got our IRB approval in May of 21. We enrolled our first patient in June of 21, and we're just completing our last enrollments this month. And in April, we'll hopefully do some we'll do our statistical analysis and then some finalized data analysis, and hopefully move on to our manuscript submissions. We've been invited already to speak at the International Sigma Theta Tau conference that's in Edinburgh in the summer, as well as our own local healthcare con, which is in June, Stanford's Healthcare Con, and we're also going to be presenting at the Western Institute of Nursing in April in Portland. So we're all really excited about that, just with our preliminary data. Next slide, please. Just a little bit of background on this Apple Watch and how and the patient population that they're using this in. Tachycardia and hypoxemia are common during seizure events. That's a given. Heart rate and movement applications by an Apple Watch or any other device do not offer comprehensive and reliable seizure detection. So there is a gap. And the lack of reliable home devices that are available to identify seizure activity are not available currently. Next slide, please. There was one really great meta-analysis in 2018 by Bruno and his group that looked at the Ictal hypoxemia prevalence. And they looked at 21 studies involving 917 patients. 2,599 seizures were included in this study, and 1,840 seizures that had blood oxygenation level data, and showed that the overall ictal hypoxemia occurrences was at a rate of 47% for the tonic-clonic seizures, and a little bit less for other types of seizures of ictal hypoxemia events. Next slide, please. So this is a correlative descriptive pilot study. The recruitment for the study is with patients that actually come into Stanford Children's Hospital for an EEG admission. Once consent is attained, an Apple Watch is put on these little kiddos for a maximum of 96 hours. Cardiorespiratory monitoring is also collected, as well as pulse oximetry at all times. The actual seizure activity is confirmed through the EEG that they've come to have at Stanford Children's. Next slide. The first thing these researchers had to do is to actually create some correlation between the watch and the cardiorespiratory monitors, which ended up being very, very good at a 95% confidence interval for both the heart rate and the SpO2 monitors, which was good and important for us as we launched the study. Next slide, please. They also did some correlations between events when actually seizures were happening. They were able to get 20 patients enrolled in this just correlative data collection with about 50, there were actually 54 seizures captured. And of those 54 seizures that were captured, the first set of data that you see on this slide is the seizure correlation for heart rate was 60%, but only for 42. The other patients either were moving too much to calculate, or the kids might have taken off the watch or turned it off or did something like that. So our ending N was a 42, but we found that 60% had exact correlation between within 5 beats with the cardiac respiratory monitors. And we also were able to track baseline data for 503 episodes of heart rate correlation during seizures. The SpO2 was a little trickier. The SpO2 on the watch, we were having trouble with exact correlation because of movement, and the watch actually only gives you 30-minute readings. So that was also a limitation of this data collection. But we did find with our baseline data where we had 300 episodes, we were able to have a 73% correlative on these kids that actually were having seizures. Next slide, please. So as the current study, currently the study, we are almost completed all of our data collection. We have 101 seizures that are captured. We have 32 patients that were enrolled in this study, 14 male, 18 female. And again, this was during COVID, so it was quite challenging. We so far have 80% of this data shows that heart rate is captured during the seizures. We have to dig a little deeper to really do more analysis on this data. And we have had 12% of our SpO2 being captured by this Apple Watch during the seizures. So we're really looking forward to drilling down on this data in the next few months. Next slide. So really what we really wanted to share with all of you today are these implications that the potential for medical devices used in the pediatric population is there. This is a clinical research study in the neuro ICU, and baseline values are significant and reliable. The heart rate of the Apple Watch is able to capture heart rate at about 80%. But unfortunately, the SpO2 and capture with the Apple Watch is pretty unpredictable at this point in the ballgame. But we're hoping that this small pilot study will help to inform larger studies in the future. Next slide, please. And this is just some acknowledgements. Myself, they've acknowledged Brenda Porter, Angela Harbour, Ayush Jaggi, who is our statistician, and the Stanford University School of Nursing alumni project grants for the funding to do the study. Next slide, please. And that's our reference page. Any questions? I'm so sorry. I have to buzz out. There's a patient issue that's come up. I work for transplant as well, but I'd be happy to address any questions if there are any in the chat.
Thank you, Annette.
Thank you, Annette.
Thank you, Dr. Taylor.
So I'm going to go on and talk about another innovation that we have done in nursing in the last year. And I did not do this. This is one of our clinical nurses. So let me share her story a little bit. She was not able to be here today. She is on vacation. Good for her. Juliet Williams is a clinical nurse. She's been a nurse for over 18 years. And she works in our interventional services department and has had many years' experiences there. And really is dedicated to quality and safety for her patients and families. So nursing often looks at technical things that are happening, practice that's happening, and to try to figure out how we can improve practice. And Juliet did this over the last year. She had a patient who came to the lab, to radiology, to have an EP study done and ablation. And when the patient was there, had an assessment done on the patient and looked good, but the study took 4 hours. And was on heparin for some time. And afterwards, the next day, they discovered an injury on the back of a leg. And after a lot of searching and trying to understand what was happening, and looking at that quality piece, that nursing really likes to look at quality and the whole piece to the puzzle, came to find out that when they were do studies like that in our setting, often devices are placed on the leg. So you have your sterile field and the device is placed on the leg. So just that added extra pressure caused some bruising to be on the back of the leg. And so decided to work with her team and figure out what could be done in the future to help prevent this pressure injury. So I'm going to show you the device that they created. So this is what was used is now being used, and they worked with the leadership team in that area and our clinical engineers to develop this device. So basically, it's this clear device that goes over the leg, and you're able to then drape it and be able to put your equipment on top of it, so no pressure is ever on the patient. And the thing that's really nice about this was we often have cases that are really long. So this was a 4-hour case, but sometimes we have cases that's 6-8 hours long. So be able to put this over the leg. So it also adjusts the height according to the size of the patient. So much like pediatrics, one size does not fit all. And so we can adjust it up and down based on the size of the patient. And then the last piece is how it goes over the leg. So the leg is placed on the yellow piece for cushioning and pressure relief, and then the device is adjusted before they're draped. So this device has really helped now, and it's a standard now that is used in our interventional services department to help prevent injuries for our patients there in the hospital. So Juliet really was able to take this concept idea and take it to our clinical engineering. There's no patent or anything on it, but they just developed a device to help provide best patient care and to make sure that we are looking at those hospital-acquired conditions. So we really are trying to make sure that we are preventing any type of injuries and be able to support our patients. Any questions? So nursing often over the last year, our nursing innovation, it's been a little bit of a slower process just with COVID. I think one of our biggest innovations have been looking at the medical devices that that have come in and adjusted practice. But we have also looked at innovation in staffing and what we could do if there was a staffing crisis related to COVID. So we never had to implement any of that, but we were able to create multiple different options to do that. And that is it for our nursing innovation. Any questions? Yes.
Can you tell us if you're planning to continue this Apple study or commercialize or take this device any further?
So the Apple study is concluding at the end of this month, actually, and so we'll be analyzing our data for that, and probably giving some feedback, like just the oxygen saturation. The Apple only looks at it every half an hour, right? So if they would monitor that a little bit more, then maybe we would have some higher correlation there. But we'll be taking that out and reviewing that data for a deeper dive for that. The nurse and engineer that developed this device have not taken it anywhere. They just did it for the organization. Nursing doesn't tend to think about things like that, but they made it for their department. So.
I think that's what I found as well, that a lot of the nurses are innovating at the bedside and using the device there, but we may not hear about it. So one of the things I hope you and I can partner with is getting the word out to our nurses about how to commercialize and transfer and translate their ideas to a product that could have an impact on even more patients.
Yes.
I think that's the goal.
I totally agree, Charlotte.
Thank you so much, Christine. This has been excellent having you here today.